Hello everyone and welcome to Eye on New Mexico. I'm Kai Porter. June is Alzheimer's and Brain Awareness Month, a time to increase awareness and talk about the impact of Alzheimer's disease across the country. And to talk about Alzheimer's disease here in our state, I'm joined today by Chris Chafin, Media Director for the Alzheimer's Association New Mexico chapter, and Kristen Gandara, the association's Program Case Manager, and Shelby Walker, a media intern with the association. Thank you all so much for being with me.
Thank you.
I appreciate it. Chris, let's start with what is Alzheimer's and Brain Awareness Month really about?
Well, it's a time to really consider what an enormous problem that we have in this nation with Alzheimer's disease and dementia. It is a very big problem, and it's one that we don't really spend enough time thinking about until it hits home. Unfortunately, if your family is affected directly by Alzheimer's, then it's always on your mind. But we want to stress to the public that Alzheimer's affects everyone. It affects us all either through family connections, or ultimately it's going to affect us through our economy. So it is time to bring that awareness to what is in fact a public health crisis.
And I know I just introduced all of you, but I want to give you the chance to talk a little bit about what you do with the Alzheimer's Association. Chris?
I'm the Media Director for the New Mexico chapter of the Alzheimer's Association.
So you are coordinating with the media and trying to get information out?
My job is to get the word out, because there's a lot of misinformation, there's a lot of non-information about Alzheimer's disease, and we need people to know not only about the disease itself and how it affects us, but also that there's help out there available, and that's through the Alzheimer's Association.
And we'll be clearing up a lot of those misconceptions and getting people all the correct information over the next half hour. Shelby, what do you do as a media intern?
I work right next to Chris.
Okay.
I help him out doing a lot of the social media, writing press releases. I go to UNM, so I'm still studying, and
Great.
He is always wanting to teach me a lot of things, and it's been great.
Okay, and Kristen is a programs case manager. What is your job?
So what I do is coordinate all the programs and services that we administer through the New Mexico chapter. So the dementia caregiver classes, education presentations, support groups, and reimbursement programs and all that stuff. So, yeah.
Okay. Now that folks at home are familiar with all of you and what you all do, let's delve into some of the issues. Chris, let's talk about Alzheimer's disease. How prevalent is this in the country and here in our state in New Mexico? Absolutely.
Well, we just got new numbers on the disease back in late March, and they're disturbing numbers. They show that the trend is continuing to rise. We now have over 5 million Americans who are living with Alzheimer's disease, and right here in New Mexico, unfortunately, we're trending ahead of the nation in growth. If you look at a picture of our state right now, there's almost 40,000 people who are diagnosed with Alzheimer's disease, and over 100,000 family members who take care of them 24 hours a day. So it takes an enormous toll on families, and we're seeing those numbers rise, which means the stress on families, the stress on the economy is also growing.
And I'm reading here, it says Alzheimer's kills more than breast cancer and prostate cancer combined. That statistic is shocking to me. I don't think a lot of people know that. Right?
I don't think so.
Right, Shelby?
Right. It's one of those things that you hear and you're like, wait, how is that even possible? But it really is astronomical.
It's part of what this Alzheimer's and Brain Awareness Month does. When you start paying attention to Alzheimer's and realize the severity of the crisis that we're in with it, there's a lot of startling statistics. And one that we also like to say is, you know, Alzheimer's is one of the top 10 causes of death, but it's the only one in the top 10 that has no prevention, no treatment or cure. And that's why we're out trying to get the word out. And that's why we work so hard to raise funds, because research is really the only way we can stem the tide. What we know is coming if we don't act.
And Chris, there's a huge cost associated with Alzheimer's and caring for patients and treating this disease, right? What does that cost?
Well, it all adds up to make Alzheimer's the most expensive disease in America. For this year, 2018, I think we're looking at $279 billion.
Billion with a B, just
billion
so
with
people
a
don't
B.
think you said million. That
Absolutely.
is huge.
And there's several factors that go into determining that cost. You know, Medicaid, there's emergency services, there's all kinds of different sort of milestones that they put into that cost, but the one that's probably the most disturbing is the amount of hours that family members put in as essentially healthcare professionals and nurses. That money doesn't get paid back. It never comes from anywhere. That's figured into this cost of Alzheimer's disease, because that's the toll. The toll it takes on families and family caregivers. You know, these are lost wages from work that they have to give up to take care of their loved one. It's their own health costs that they incur, because a full-time dementia caregiver starts to neglect their own health, and they start to have problems with other chronic illnesses.
So it sounds like a lot of indirect costs associated with this. Does insurance cover a lot of the direct costs usually? Depends. Kristen, is that a question for you?
It really depends. You know, if they're on Medicaid, that does help out a lot of the families that need in-home health care. But a lot of people can't qualify for that for whatever reason. So they are private paying for most of these the care in home and facility too, and that's very expensive. So
yeah, I bet that can be a huge stress factor on family members of somebody with Alzheimer's. And Kristen, earlier Chris mentioned there is no cure, proven treatment, or prevention. So what are the signs? Because I think that's something that we do know, right?
Right. So one of the biggest signs is if the memory problem is significantly impairing their daily life and activities in any part of their life, then that's a big warning sign right there. There's a lot of times when they have problems planning activities where they used to be able to plan. Have problems with money issues, as far as, you know, not being able to pay their bills correctly, or paying their bills maybe too many times in a month. So there's a lot of things that happen because the disease affects your whole thinking process. There's not one part that is safe. So really just trying to navigate through the day, it gets harder for the person.
You know, I think we all have those moments where did I park the car when you walk out of the grocery store? Or where did I put my keys? I do this all the time with my cell phone. Where did I put my cell phone? That's why I always try to keep it next to me. But when do those instances become worrisome, or should become worrisome?
We can backtrack our steps if we lose our keys or our cell phone. People with the disease are showing symptoms. They're not going to be able to do that. So they're really going to be at a loss if they misplace something. They're not going to be able to tell you where the last place they were. You know, maybe where they could have put it. So that's when you start thinking, maybe we need to go see the doctor to see if we can get an assessment.
And when do those symptoms for somebody that will develop Alzheimer's disease, when do those typically develop? I read somewhere 65 usually?
That's an early onset.
Okay.
So it's usually about mid-80s, early 80s. So
there's early onset and then late onset.
Right.
You could look at it like 65 is kind of when they average it all out, because there's another a whole set of people that actually get it at an even younger age, when it's younger onset, and you know, those statistics are growing too. But I think one of the things that kind of tie into Alzheimer's Brain and Awareness Month is it's not just a problem of people of a certain age. It could affect any of us, whether it's directly or through a family member, or, as I mentioned before, economically being one of the most expensive disease in America.
And I'm glad you mentioned that, because Shelby, I want to bring you in on that point, because tell people your story. You have personally experienced the effects of Alzheimer's, right?
Correct, yes. So my grandma was diagnosed a few years ago, but it didn't really hit home until about last year when I started working at the Alzheimer's Association. And like not within a week, my grandma had ended up in the hospital with low potassium because she wasn't wanting to eat. And then from there, it all went on to even worse things. And she ended up passing away about 2 months after she had been in the hospital. Thank you. But yeah, it's one of those things where you don't think about Alzheimer's until it affects you, but it's something that we should be thinking about now. And especially for someone my age, like I want to have a healthy brain. I want to be doing everything in my capability to be able to live and see my grandchildren get married and stuff like that.
And I want to ask more about, is there anything you can do to kind of prevent Alzheimer's? But first, Shelby, can you touch more on how this is really a family disease and how this kind of affected your whole family in terms of, was it the care, was it the emotions that you go through watching a loved one deal with it? I mean, everything?
I think the emotions was a really, really big thing. You don't really know what's happening, and you're sitting there watching this person that's had such an impact on your life kind of go back to where they don't remember you. And so the last few times that I saw my grandma, she thought that I was her aunt, and her aunt had been passed for a good 50 years. And so it's one of those things where grandchildren and nieces and nephews are seeing their loved one really truly deteriorate, and it's crazy.
Yeah, I can only imagine. I have a lot of friends who have lost a loved one to Alzheimer's. I've even had some family members too. So it's so hard. But how do you get through something like that?
I had the Alzheimer Association, which was such an incredible blessing on my life at the time. I had all of this support, but I also had my parents, the rest of my family loving on us, and we kind of just said our prayers, and we, I don't know, we're still a little grieving, but it is hard.
I'd like to say, to sort of inspire other volunteers who might be interested in the chapter and in the association, is I think Shelby came to us in a way to sort of make sense of the situation that was going on with her family, but ended up just contributing hugely to not just the work that we do in helping people in the community that need our help, but also in getting the word out as a media intern, which is part of her focus at UNM. So we look to each other for support.
And I want to go back to one of my earlier questions was, I know the cause of Alzheimer's is really poorly understood, but is there anything that is believed to maybe be linked to it? I know it's believed that genetics play a big role, right?
Genetics play a role.
A role.
We don't know, and that's the hardest thing to say, because it's hard enough for us to be on television and tell you we don't know. Yeah. But when a family that's just diagnosed comes in and we tell them we don't know, that's equally difficult. It's a mystery that can be solved. It can be solved once we get serious about Alzheimer's disease, once we start spending the same amount of money for research that we do on the other top 10 causes of death. When you look at other comparable diseases like heart disease and cancer, you see huge breakthroughs. Huge breakthroughs in treatments, prevention, and we need that sort of focus on Alzheimer's disease. And that's the other thing that we do at the association, is we advocate. We appeal to the lawmakers to not just make laws that are easier on caregivers and help them in their dilemma, in their situations, but we need research. We need increased funding so that we can know what these causes are and then reverse engineer to how to prevent this.
We have about a minute left before we have to head into break, but Kristen, I know you have a number that we want to put up on the screen if we could. Do you recommend people call this number if they have questions about themselves or a loved one and how to deal with this?
Definitely, and we do have 24-hour counselors online, so if they're in a crisis situation with the person with the disease, they can call that number and actually talk to someone to help that situation at that time.
Yeah, and the number up on the screen there, 1-800-272-3900. Chris, that's a 24/7 helpline?
Yeah, and as Kristen pointed out, it's not just a hotline, it's a helpline. Even if you have a simple question or you have a more complex question and it's the middle of the night, call that number. Don't hesitate. We made it easy for you to access, and the people that staff those lines are very well trained. So don't hesitate. It's absolutely free.
Stay right here because we have a lot more to get to right after the break. We're going to talk a lot more about what the Alzheimer's Association does, so stay with us. We'll be right back. Welcome back to Eye on New Mexico, everyone. And if you're just joining us, we've been talking about Alzheimer's and Brain Awareness Month. Our guests today are Chris Chafin, Media Director for the Alzheimer's Association New Mexico Chapter, Kristen Gandera, the association's Programs Case Manager, and Shelby Walker, a media intern with the association. So thanks for sticking with us. I appreciate it. Before the break, we were talking a lot about Alzheimer's disease and what we know about it at this point and a lot of the resources that are available. But Chris, can you talk a little bit more about what you guys do as the Alzheimer's Association, because you are the New Mexico chapter, right?
Absolutely. Well, we're part of the larger organization, which is the Alzheimer's Association. We're the New Mexico chapter. Our main office is here in Albuquerque, and we have 5 branch offices across the state. We do 2 main things. We help families that are affected by this disease directly. So we provide free services and support programs. We educate them because, as we mentioned, when someone's family is affected by Alzheimer's disease, the person who is not diagnosed automatically becomes the caregiver. So that could be it's a loved one typically. It's either a spouse or an adult child or another friend or a relative. That person needs to be educated. They need to learn about dementia caregiving, which is probably the world's toughest job. And it's a 24/7 proposition. So people get diagnosed, they leave the doctor's office with the diagnosis, they don't know where to go. They usually come to us, and we do everything we can to help them. We have free classes. I should mention all of our services are free because that help is so essential to people. So from education courses to support groups, Kristen mentioned care consultations. We have these situations where we can have people come up and talk about their own personal situation, what's going on with them, and what resources might be available to help them. And it's a really valuable thing to have, as well as things like we do classes on legal courses, because that's another thing that you have to know once you get a diagnosis. You have to get your legal business in order. I mean, there's medical power of attorney, there's all sorts of trust issues and things like that. So all of these things that a family may encounter once there's a diagnosis, we help them with. The other thing that we do is we raise funds for research. And I would like to mention here in New Mexico, we're very fortunate at UNM to have some of the brightest researchers and hardworking researchers who work day and night on trying to solve some of these mysteries that we're talking about cause and preventions. And we're very fortunate to have them as partners.
And I want to touch more on the research, delve more into the research aspect in a moment, but I want people to know that you serve the entire state, right? And a lot of communities through your main office here in Albuquerque, and you have 4 regional offices across the state. Chris, we had the number up, the hotline earlier, but let's put that back up. And this number, you can call this number 1-800-272-3900 to get in touch with the association if anything you said somebody might be interested in taking advantage of those resources.
We
right?
tried to make the number sort of like one-stop shopping. So it doesn't matter if you're in a metro area or you're in a rural or tribal area. This number will get you through to someone who can help you and answer that question. So whether it's us at one of our regional offices or whether it's a trained social worker in another place, you will get what you need by calling this number. And that's why we stress it so much. 1-800-272-3900.
And we'll keep that up throughout this broadcast too. How many people do you guys serve throughout the state? Do you have an idea?
Well, we know how many people are diagnosed.
And that's again?
And that's 39,000 exactly. And we know how many people are taking care of them. 107,000. But these are the people that we know about. We also know that there's a lot of other types of dementia. There's a lot of other family members who may not be the primary caregiver. So I'm comfortable saying we serve the entire state, and we're still looking to serve more.
Great.
Because we want people to get help, and if we can't help them, we can find something or someone who can.
Perfect. Shelby, I want to get back to you and your experience with the Alzheimer's Association New Mexico chapter, because if people are just joining us, you have a very personal experience with Alzheimer's. Your grandmother passed from the disease, correct? And this is how you got involved with the association. Talk more about how you got involved, and now you're a volunteer?
Yes. Yeah. So, I mean, he sent out an email to UNM. They asked for an intern, and all of this stuff fell into place at the same time that I was looking for some comfort and some knowledge on this disease. And so I think the biggest thing is the education that we provide. And unfortunately, my family didn't really know about the education. They were very private, and my grandfather just wanted to kind of let this be their own thing, which honestly in New Mexico happens a lot. We're very private people.
Why do you think that is? Do you think there's some people are embarrassed by it, or are just very private?
There's a very big stigma.
Yeah, that's the word I was looking for.
About the disease. People think that Alzheimer's is this thing that you're bound to get when you get older, and that's very incorrect. Alzheimer's disease is an unnormal part of aging, and so we at the association are trying to help people realize that, and I wish that I would have been able to help my family use our resources, like all of what we have, because it's so helpful.
Well, you're doing a great thing letting others know
Thank
that,
you.
that are, because I know there's so many out there, thousands and thousands of families and people that are in the situation you were in. And Kristen, earlier Chris was talking about some of the resources you offer with the association. I want to talk about one in particular, the Skills for Dementia Caregiving 101. This is what you call the Savvy Caregiver Program. Talk about that and what is that?
So that's a 6-week program. It's 2 hours per week for 6 weeks. And what we do is we go over the progression of the disease, as we touch on the stages of the disease. And then we also make sure that the caregivers take time for themselves. You know, get thinking about taking time every day to step away from the person they're caregiving for and take it back for their stay as an individual, and they don't just get absorbed with the whole disease with that person. So, because a lot of times the caregivers, they ignore their own health problems and just life in general, and they end up getting sick and can't care for them. So,
what are some of the skills you teach specifically?
It's just techniques. It's just a lot of techniques. It's a lot of actually getting past the denial that the person has the disease and that you can't stop it. So that's a big part of it, is making sure people understand that, you know, this disease, if you have it, you're going to have it, and we're going to walk through it together pretty much. And just hopefully so they understand what they're dealing with and going forward what they're dealing with, because as the disease progresses, it gets harder. It's more 24 hours hands-on caregiving rather than just kind of watching them and making sure they're okay. So.
And Chris, why is it so important that a caregiver, a family member, be it a spouse, a sibling, a son, a daughter, have these skills?
Well, it's you know, as Chris was talking, it's an enormous responsibility to take care of someone with dementia, and it changes as the stages change.
It progresses. It gets worse.
Yeah, and yeah, I mean, it's an ironic term, but as it progresses, it gets worse, and there's different behaviors associated with that progression, and a lot of the things that really cause people anxiety are things that we can explain. They wonder why their loved one is being argumentative or exhibiting paranoid behaviors or not realizing that something is perfectly logical in their argument. What we have to teach people is to manage their expectations. They're not going to win an argument with somebody with dementia. They need to adjust their own expectations, observe those behaviors, and appreciate them as symptoms of a fatal brain disease. And so Kristen teaches people what this disease does to someone, and then they understand how to manage that.
And any of you can answer this question. I've been a news reporter for 10 years, and I've unfortunately covered a lot of tragic stories where you have loved ones who are suffering from Alzheimer's or dementia wander off, and bad things happen to them. When does somebody need to consider putting their loved one in a facility that can monitor them 24/7? Because loved ones can't always monitor a person with Alzheimer's for 24/7.
When I'm asked that question, I usually tell them when it's not safe for that person and for the person that's caregiving for them. When the safety is at risk, at that point they really should start talking even to us about what their options are for facility setting. So it's a hard conversation piece, but you know, safety.
Nobody wants to have that.
Everyone needs to be safe. So.
Yeah.
I was just going to say, wandering is it's so dangerous, and people don't really realize that. But when somebody with dementia does wander, the longer they're gone, the more likely it is that they're not going to be able to return.
Yeah.
So it's something that people who have elected to take care of their loved ones at home need to be very conscious of.
Yes. Just a few more minutes left, but I want to get back to the fundraising that you guys do. You have a lot of events throughout the year where people can get involved, and you guys raised funds that I'm assuming go towards research and trying to find a cure?
They go to research, and they go to help us provide these services that we just talked about. It's both. We have two big events this month. Shelby, you want to?
Yeah, definitely. So we have the longest day, which is a do-it-yourself fundraiser. You can literally do whatever you want. You can ride your bike. You could do an event at a restaurant where they donate money. It's totally up to the people that want to raise the money. And that's what's cool about this fundraising event.
So you take pledges or something? How does it work?
I'm sorry?
You take pledges? You create your own event and then,
yes.
okay.
So yeah, there's people that do like a yoga day at their yoga studio. And so whoever shows up, proceeds of it goes to them. Yes, sorry. And then the other one that we have the Unforgettable Golf Tournament. That's on June 25th. That one is at Tanawon Country Club, and that is just a really fun day for our sponsors, then golfers, to
The public.
The
public to have a little bit of fundraising going on.
And what are the dates for
awareness.
those two this month?
So the longest day is on June 21st. However, because it is a DIY fundraiser, we encourage people to do it whenever they want. It's not something that has to happen on the specific day.
Got it. Okay.
And then the golf tournament is on the 25th of June.
And how does somebody, do they have to go on your website and register for one of these events, or how do they get involved?
I think the best way is actually just call us directly in the Albuquerque office, because since both those events are happening pretty soon, I'd go 505-266-4473, grab a pencil, 505-266-4473, and that's directly to our office in Albuquerque.
And what we'll do is we'll put a link to your website with the Alzheimer's Association New Mexico chapter on our website, kob.com. Just click on the 4 links section for more information. Shelby, last word for you. What do you want to leave people with who may have a loved one who has just recently been diagnosed with Alzheimer's disease and they're going through what you've gone through?
I just want to encourage them to stay positive and to remember that this isn't easy, but it's going to be okay, and that as much as you want, you're not going to be able to fix what's happening with your loved one.
About 30 seconds left.
I would
Chris, last
say,
word?
in the same vein, I would say don't hesitate. Reach out for help. Don't be afraid to reach out for help. The more you know, the more you can help.
Thank you all so much for being here to talk about this very important topic. I appreciate it. And thank you all for watching. We'll be back next weekend with another Eye on New Mexico.